Hello, dear friends. Orgasm is not just an emotion, it's biochemistry. I'm delighted to welcome you. Today, we're going to have a very important conversation. I would even say a therapeutic one. We're used to discussing women's health in the context of diseases, childbirth, or infections. But today we'll talk about a topic that often remains behind closed bedroom doors, even though it should be discussed in a doctor's office. We're going to talk about the female orgasm. And right away, I want to remove the taboo surrounding this subject. You know, many of my patients come to me feeling too embarrassed to admit they don't experience pleasure. Yet from a medical point of view, orgasm is not debauchery and not merely a pleasant bonus. It is an extremely complex physiological process that is critically important for your hormonal balance, immunity, and even the condition of your teeth. Yes, don't be surprised. What happens to your body when you become aroused? Let's look at it through the eyes of a physiologist. When libido arises, a real storm begins in the pelvic area. Doctors call this the formation of the orgasmic platform. Blood rushes actively to the uterus, blood vessels dilate, and the organ literally increases in volume. This is a workout for the vascular system, comparable to a good cardio session. At the moment of climax, a sharp spasm occurs. Contractions of the uterine muscles, vaginal walls, and pelvic floor. All that hormone-rich blood is then powerfully released into the general bloodstream. It's a kind of system reboot. And if this doesn't happen, if there is arousal but no release, we get blood stagnation in the pelvis. And chronic stagnation is a risk factor for developing fibroids, mastopathy, and other gynecological problems. That's why today we'll go through everything, from hormones to types of orgasm you may have never even heard of. Have you ever wondered why nature gave women the ability to experience orgasm at all? With men, everything is clear. Ejaculation is necessary for reproduction. But with women, scientists are still debating. There is an interesting study conducted by our colleagues at Yale University. They analyzed evolution and came to the conclusion that the female orgasm might be an evolutionary leftover. Sounds a bit offensive, doesn't it? The thing is, in many animals, for example, rabbits, cats, or camels, ovulation, the release of an egg, doesn't happen spontaneously. They need sexual intercourse and a hormonal surge to trigger the process. No sex, no ovulation. In women, through the course of evolution, ovulation became cyclical and concealed. We don't need a male to release an egg. And the Yale researchers believe that orgasm remained with us as an inheritance from the times when our ancestors reproduced like rabbits. What's more, as evolution progressed, the clitoris moved from an internal position which reduced the chance of accidental orgasm during every act. But as a practicing physician, I cannot agree that it's a useless vestige. There is a theory that we observe in the clinic. Orgasm can help with conception. During the peak of pleasure, the cervix performs specific suction-like movements. If ejaculation occurs at that moment, the uterus literally helps the sperm reach the interior faster, increasing the chances of pregnancy. So nature doesn't do anything just for fun. Let's talk about beauty. Many of my patients spend huge amounts on cosmetologists, creams, and supplements. But you have a free source of youth right inside you. During orgasm, a powerful cocktail of hormones is released into the bloodstream. 1. Estradiol. This is the main hormone of female beauty. It makes hair voluminous, skin smooth, gives that signature sparkle in the eyes, and ensures proper mucous membrane hydration. Women over 50 who maintain an active sex life often look younger than their peers precisely because of estradiol. 2. Oxytocin and endorphins. These are the hormones of happiness and bonding. They trigger euphoria and, importantly, have a pain-relieving effect. 3. Prolactin. Right after orgasm, prolactin levels spike sharply. By the way, that's exactly why we ask patients to abstain from sex for 1 to 2 days before prolactin blood tests to avoid false positives. And here's one interesting fact few people know. An active sex life protects your teeth. Research has shown that people with regular intimate activity have higher levels of antibacterial substances and immunoglobulins in their saliva. This helps shield tooth enamel from caries. So sex is also a form of prevention against dental problems. Now let's move on to pain. Headaches, migraines, menstrual cramps. "I have a headache" has become a classic excuse turned into a joke, but from a neurophysiological perspective, it's a mistake. Sex relieves headaches better than analgesics. MRI scans show that during orgasm, brain activity shifts in a way that significantly raises the pain threshold. Endorphins act like natural opiates. This is especially true for menstrual pain. Recently, the company Womanizer conducted a unique clinical study called Menstruation. Nearly 500 women participated. The results were striking. 90% of participants confirmed that masturbation helps relieve menstrual cramps. The intensity of pain decreased even after the experiment ended in subsequent cycles. Why does it work? First, the dopamine release reduces stress. Second, after the orgasmic spasm, the uterine muscles enter deep relaxation, which eases painful cramps. So, if you suffer from painful periods, don't rush to take pills right away. Try tapping into your body's own resources. We live in an era of chronic stress, and there's a trap here. Austrian researchers from the University of Vienna found that stress and the hormone cortisol impacts women much more strongly than men. High cortisol literally kills female libido. It creates a vicious cycle. You're stressed, you don't want sex. But sex is actually the best way to lower cortisol. This is especially important for sleep. Studies from the University of Groningen showed that sex with a partner that ends in orgasm acts like a powerful sleeping pill. On average, people fall asleep 16 minutes faster. This happens thanks to the sense of safety and hormonal release. Interestingly, masturbation has a weaker effect here. Falling asleep is almost the same as without sex. Apparently, the factor of intimacy with a partner plays a key role for the nervous system. And by the way, the myth that the brain shuts off during orgasm is wrong. fMRI scans show that the brain doesn't switch off. It redistributes activity, altering pain perception and consciousness while remaining active. All women are different, and our orgasms are different too. Check. Researchers recently conducted an intriguing study using sensors and identified 3 types of female orgasm based on how the pelvic floor muscles contract. Try to recognize yourself. 1. Wave type. This is the most common type. The muscles contract and relax in a wave-like sequential manner. This was experienced by 26 out of the 54 participants in the study. 2. Volcano type. Here the dynamic is different. First relaxation, then a sharp, powerful tension, followed by relaxation again. 3. Avalanche type. Tension builds, and contractions only occur at the very end, at the peak, like a snow avalanche. Scientists are still debating, can one woman experience different types, or is this an innate characteristic, like temperament? But the important thing to understand is that any of these types is completely normal. But what to do if this miracle doesn't happen? According to statistics, only 29% of women always experience orgasm during intimacy. For comparison, in men that figure is 75%. The condition where there is arousal but no release is called anorgasmia. It can be primary when a woman has never experienced orgasm in her life. Secondary, when orgasm used to happen but disappeared due to stress, childbirth, illnesses. The causes can vary: physiological, diabetes, taking antidepressants, hormonal imbalances, declining estrogen during menopause, which reduces clitoral sensitivity. Psychological, incompatibility with a partner, strict upbringing, inability to relax, fear. Very often, the problem is solved simply by getting to know your own body. Many women can only achieve orgasm through clitoral stimulation, and this is absolutely normal, not a pathology. To wrap up our long conversation, I want to say this: orgasm is not shameful. Masturbation is not shameful. It's a normal way to relieve tension and pain, one that doctors recommend. Remember that during the time it takes to reach orgasm, you burn about 200 calories, equivalent to half an hour at the gym. You train your heart, strengthen your immunity, and prolong your youth. If you have issues in this area, don't stay silent. Go to a gynecologist, endocrinologist, or sexologist. Your pleasure is the key to your health, sparkle in your eyes, and longevity. Stay healthy, love yourself and your partners. See you soon.